Ted, thank you very much, and Raquel, that was a great talk, and I think your overview of the pharmacology was very helpful, so I know almost nothing about this subject and probably know less about it than you do, but the opportunity to give this talk, and when Teddy asked me to do something, of course I'm going to do it, has given me the chance to learn, and there's nothing like being asked to talk about something as an opportunity to learn more. My disclosures, and I guess the reason why I was assigned or asked to do this talk is I live in a state with both medical and recreational marijuana legalization just down the road from here, as is, of course, the state of Washington. I have used medical marijuana in my practice for some time. I do esophageal cancer surgery, and one story, I had a patient who was wasting away with intractable nausea with metastatic esophageal cancer, and gave him a prescription for PO Marinol. He came back about, 6 weeks to 3 months later, having gained 20 pounds and with a big smile on his face. And his wife said, "This is all very good, but I can't get him to stop sitting in front of the TV and laughing." I said, "Okay, there are side effects to every drug. Some of them are not so bad." So I do want to point out, though, that it is still considered illegal to have detectable THC in the bloodstream for federal employees in Oregon or any state. And one of our incoming residents had a drug test proved positive for THC, and for 6 months was unable to serve his residency. So beware of this. So I just wanted to take you through a little bit of history. I think my talk will be a little complimentary to Raquel's. In 1600, hemp production was common in the U.S. It's not advancing. There we go. And it really wasn't sort of vilified really until the early 20th century, when it was described as the marijuana menace, and it came with a wave of Mexican immigration. And it really became it was really sort of cultural racism that first sort of demonized the use of marijuana. And this was especially, this thing is not advancing. Let me try this one. There we go. It was especially true in the 1930s during the Great Depression, when there was a competition for jobs between unemployed, sort of domestically raised Americans and the wave of immigration from below the border. And marijuana use was outlawed in 29 states, and this sort of led to a propaganda movie called Reefer Madness, which was put forward in 1936. And this is a trailer.
Having a hop at the local soda fountain. Innocently they dance. Innocent of a new and deadly menace lurking behind closed doors. Marijuana, the burning weed with its roots in hell. In this film, you will see the ease with which this vicious plant can be grown in your neighbor's yard, rolled into harmless-looking cigarettes, hidden in an innocent shoe or watch case.
If you want a good smoke, try one of these.
You will meet Bill, who once took pride in his strong will as he takes the first step toward enslavement.
Of course, if you're afraid.
Destroying reefer, they find a moment's pleasure, but at a terrible price. Debauchery, violence, murder, suicide, and the ultimate end of the marijuana addict. Hopeless insanity. Important bill now, before it is too late.
That's worth the price of admission, right? So, anyways, this was where it was. This was sort of just post the end of Prohibition. In 1950s, actually, the laws became even tougher. There are minimum sentences imposed for marijuana use. But in the 60s, in the counterculture era of the 60s, marijuana use became popular. And in the 70s, there was actually a repeal of those minimum sentences. And the Schaefer Commission, which was actually commissioned by Nixon, urged decriminalization, which Nixon ignored, as you can imagine. And in the 80s, in the Bush-Reagan era, the renewal of the war on drugs actually increased the criminalization and the penalties for marijuana use. So it really wasn't until the late 1990s that the tide started to turn with medical marijuana legalized in California. In 2012, Washington and Colorado became the first two states to legalize recreational sales. Alaska, Oregon, and D.C. followed suit in 2014, and 4 more states passed similar not similar legislation, but passed legislation legalizing recreational and personal use in 2016. Vermont in 2018, as Raquel said, there are a number of others on the ballot. However, recreational dispensaries have not been opened, as far as I can tell, in the East, although Massachusetts has a date of July 1st to open recreational dispensaries. There may be some others that I'm unaware of, but that's what I could read. So really the debate here is it a gateway drug? And the Institute of Medicine sort of wrestled with this in 1999 at the sort of cusp of the change in attitudes towards marijuana. And you can basically read it yourself, but because underage smoking and alcohol use typically precede marijuana use, marijuana is not the most common and is rarely the first gateway to illicit drug use. There's no conclusive evidence that the drug effects of marijuana are causally linked to subsequent abuse of other illicit drugs. So that was the Institute of Medicine. Sounds like it's pretty well done. But it really wasn't. The debate raged on, and through the second Bush presidency, you'll see some quotes from the National Institute of Addiction that were different. But this was a really nice piece in Time magazine that basically said it was associated the illegality of it with the gateway hypothesis, thus that if you actually had someone from whom you bought marijuana, they might, after a bit of trust, offer you the opportunity to buy stronger substances, including opioids. And the data really sort of doesn't support the gateway drug hypothesis. You can see, again, the numbers of people who use pot, about 2.3 million, as opposed to 180,000 in 2010, who admitted to using heroin. And if we can kind of move into the more contemporaneous era, this was the recent director of the National Institute of I think it was Drug Dependency and Addiction, although I'm not actually sure what the D stands for. But he said that he felt that there was evidence suggesting that the use of marijuana primed the brain for enhanced response to other drugs. That data you see around, but that data is actually based on rodent data and has never been reproduced in humans. So that sort of is been debunked in many other subsequent scientific studies. This from the Johns Hopkins School of Public Health, Colleen Berry, who's done some epidemiologic work looking at the incidence of opioid overdose deaths in those states where medical marijuana laws were in place, and showing a 25% decrease on average in opioid overdose. Medical marijuana may be an effective way to treat pain, but it's not a treatment for opioid addiction. This is one of the graphs from Dr. Berry's article in the JAMA Internal Medicine. Actually, the caption is backwards. It took me a while to figure this out. But states with a medical cannabis law had a lower rate of opioid-adjusted analgesic overdose deaths by 20%. Graph is actually accurate and shows how this was a cumulative effect, 20% at the outset and actually accelerating to over 30% decrease in opioid deaths 6 years in to that. And this was sort of validated in a second study in the American Journal of Public Health published last year looking at opioid-related deaths in Colorado, showing an inflection point in 2014 when marijuana was legalized. Another study that looked at the frequency with which opioids were found in traffic accident victims who were killed in states with and without legalized marijuana, and that lower line with lower rates of opioid positivity are in those states that legalized marijuana and after legalization. But I think all of these graphs, I think it's important to point out that the rate at which you detect opioids and the rate of opioid-related death is still or has increased so dramatically, and I think Raquel showed that as well. Let's look for a little perspective, looking at the Netherlands. Marijuana use is less prevalent in the United States, and those who do consume are less likely to use other illicit drugs. Dutch experts believe that marijuana smoking is boring and it separates the soft drug from the hard drug market. So this was sort of a forum in the New York Times that I thought was very well done. And it was really, this is sort of the impact of the stigmatization of marijuana use on the sort of underrepresented minorities and how this is sort of used as really a discriminatory effect. So just to sum up, this is the current state as of 2 months ago from the NIH. Marijuana use is more frequently associated with alcohol and nicotine use than it is with harder drugs. The majority of people who use marijuana do not go on to use harder substances, so it is not a gateway drug. So we are 5 years in. Were the predicted effects of legalization borne out? And one is that criminal elements would be attracted. Well, it turns out that in states that have legalized it, crime rates are down. Impaired driving, in fact, this one has been borne out. 2.7% increase in insurance claims in states that have legalized marijuana. Youth exposure, actually, it turns out that those states where marijuana has been legalized, there's a decreased utilization amongst minors. Economic boom, absolutely. Tax revenues in Colorado, 135 million. Tax revenues in Washington, 230 million, all going to either education or health care. An end to criminalization. Interestingly, Oregon and California have expunged marijuana convictions from records. Washington and Colorado have not yet done so, but that is also an important aspect. But the stigma is really not gone despite legalization. So here's the point. Marijuana is legal in Washington state. Many of you will go to the sing-off tonight. Many of those who will attend will have a drink in their hand when they greet you. Would you feel the same about them if they greeted you with a joint in their hand? And more importantly, would you feel comfortable if your boss saw you sharing their joint? And I would suggest that probably that's not the case, and so the stigmatization still exists. So in summary, is marijuana a gateway drug? There's no convincing evidence to support this hypothesis. Decriminalization and the use of marijuana for pain control may reduce the frequency of opioid addiction, especially in states where recreational marijuana has been legalized. Even in states with marijuana legalization, there remains a social stigma to marijuana use that's a little different from states that have not legalized marijuana use. All of us as surgeons who work in VAs and other systems must be aware that federal laws may affect your job and local institutional laws may also affect your job. So be careful of that. So thank you very much for the opportunity to present. Thanks, John. Yeah.